Hey y'all, hope you're having a great day. Today's topic is going to be PCOS, or polycystic ovarian syndrome, and we're going to discuss what implications it has for women during their lifespan and their reproductive years. So let's get started. What is PCOS? PCOS is a condition due to hormonal changes that primarily occur during the reproductive years for women. Causes of PCOS: insulin resistance. The insulin production in the female body increases, which increases the production of androgens, or the male hormones that are circulating in a woman's body. Low-grade inflammation. Low-grade inflammation is due to white blood cells producing a substance in response to infection or injury inside a woman with PCOS. Women with PCOS have been found to have mild inflammation, which produces those substances and causes the increased production of the male steroids or androgens. Long term, this can lead to heart disease or problems with the blood vessels in women if not controlled or managed. Heredity. Certain genes have been linked to women having PCOS, and if your mom, sister had PCOS and you're exhibiting symptoms, then you may possibly have the same diagnosis. Complications of PCOS are going to be obesity, infertility, increased risk for type 2 diabetes or gestational diabetes during pregnancy, increased risk for miscarriage or preterm labor or preterm birth, fatty liver disease, facial hair growth on the body where women don't typically have hair growth, such as the abdomen, acne, sleep apnea, depression, anxiety, eating disorders, cancers of the uterine lining, irregular periods. There are a lot of side effects or potential risks to having PCOS. How is PCOS diagnosed? Pelvic exam to make sure there are no masses felt during the exam, blood work to check certain hormone levels, pelvic ultrasound, which could either include a transabdominal or on top of your tummy, or a transvaginal, which is a wand inside the vagina, to get a good look at the ovaries, to look at the uterus and make sure that the uterine lining is normal. An evaluation of symptoms. Having that conversation with your provider and evaluating, going over symptoms and signs that you may have can also lead to treatment. How do we treat PCOS? The first thing is going to be lifestyle modifications, so dietary changes and exercise. Medications. So different medications can be used to treat the symptoms of PCOS. Birth control can be used to help with the abnormal periods. We use metformin as a medication to help with the insulin resistance. Inositol can be used to help with the symptoms of PCOS and may even help with period regulation. If a woman is trying to get pregnant, there are certain medications that can be used to help with pregnancy. So Clomid, Letrozole, Inositol can all help to increase the chances of pregnancy in women with diagnosed PCOS. To treat the excess hair growth and the acne that women may get or that may accompany polycystic ovarian syndrome are going to be birth control pills. There's different medications that can be prescribed either by your primary care, your gynecologist, or a dermatologist to help with the hair growth and with the acne. Vanicua is a cream that can be used on the skin to help decrease the hair growth. Laser hair removal is an option to help with the hair growth. This is just a very short discussion on what PCO is and is not. If you have any questions, any concerns, talk to your provider. If you're having symptoms or you think you're having symptoms, let your provider know. Have that discussion. Get the blood testing done. And while you're waiting on all that to be done, you can go ahead and start with self-treating with diet and exercise modification to see if that is all you need to help. I hope this has been helpful, and I hope you guys have a great day. Thanks.